Hi everyone, it's Kerry Shearer for NPHIC at the 2013 NACCHO Annual Conference here in Dallas, Texas. And hey, did you catch our live webcast earlier from the exhibit room? What a photogenic crew. Well, the day kicked off with a general session on the Affordable Care Act and public health. And you know, one thing is clear, public health communicators can expect some calls from the public who aren't sure just how we fit in with the Affordable Care Act and all of that. And we certainly need to do as good a job as we can letting the public know exactly what it is we do. Now, as I mentioned in yesterday's update, the CIRC training was a huge hit on Tuesday and Wednesday. And here is part 2 of my interview with CDC's Dr. Barbara Reynolds about CIRC.
Beyond having a willingness to speak, it's important to know some basic principles. In crisis and emergency risk communication, we focus on the need to express empathy, which means the willingness to acknowledge in words what people are feeling. Oh, emotions are not things that we always want to talk about, and we think as officials, public officials, that perhaps emotions are taboo. We shouldn't talk about it. The research shows us that if we take the time to say in the words our understanding that someone is suffering in that moment, or they're frightened, or they're frustrated, angry with us, whatever, if we take a moment to express our understanding of the way people are feeling, that they will be more open to the information we're sharing. So that's an important thing that we can do. Another thing that we can do in a crisis situation to help improve the outcomes for individuals, for their families, for the community as a whole, or maybe the nation, is to give people things to do. What we have found is research tells us and practical experience shows us that when a crisis occurs, people want to help. They want to be involved. They also want to take steps to protect themselves and their loved ones. And so the quicker we can get out there with a message that helps people move in the right direction, the better off we are. But we have to be careful. If we give people things to do that seem too difficult, or it doesn't seem like from common sense that you would want to do that, then we have a different communication challenge. And that's part of what crisis and emergency risk communication addresses, is some of the nuances that have to come with that work.
One of the more exciting areas here in the exhibit hall was where the pod medic, Jamie Davis, had all of his webcasting gear set up. He was doing video podcasts and interviews, and I had a chance to sit down with him and talk a little bit about how communicators could get started doing their own audio podcasts.
It's not expensive, and it's very easy to get started creating that content. Every computer out there right now is built with has some built-in software that will allow you to record audio from the built-in microphone, for instance. For less than $100, you can get a pretty decent plug-in microphone. It'll plug in via USB to your computer. So if you want to step up beyond the built-in microphone, for less than $100, you can get a decent microphone that'll plug in to a USB port, and your sound will be infinitely better instantly. And then you can use built-in software, or you can use some free software like Audacity, which is a great program that's free, well supported, and allows you to record audio programming, edit audio programming, insert music if you want after the fact, or things like that. And then, if you want to go even a step further and you want to think about being even more high-end, there's an app for that. And and I were talking about this. There's a great app called Boss Jock.
I just downloaded it for the first time about a week ago. It looks incredible, and it works on an iPad. Yeah,
it works on an iPad or an iPhone. It allows you to record using the built-in microphone, or you can use one of the available plug-in microphones that are out there for the iPad or the iPhone. And the great thing is that it records in a format that can be instantly uploaded. It'll upload the material for you to your website if you want. It has built-in slots, so if you have opening music, you can talk to somebody and then hit a button on your screen, and it rolls your music in. And then when the music's done, it automatically brings your microphone level back up, and you start talking again. It's a really slick piece of software that, as you know, most of those apps for mobile devices aren't that expensive. I don't know how much it is right now, but I think it's less than $10.
What's the best way to get in touch with you, Jamie, and your website and see your podcast?
Well, you can find all of the programming I do in various formats over at mediccast.com. So from there, you can find all of the 6 or 7 shows I do on a weekly basis.
Oh, that's a load.
Well, it's a business for me now. I mean,
Yeah.
I used to be a practicing nurse and paramedic. Now I am a healthcare journalist. And because of that, I have a lot of shows and programming I produce. But you can reach me over there. You can find me on social media channels under @Podmedic. On Twitter, or Podmedic on Facebook, so facebook.com/Podmedic, or any place under the handle Podmedic is pretty much easy way to find me.
And finally, a big honor tonight for Mary Solecki. She is the former Secretary of Health for the state of Washington. She is receiving NACCHO's Maurice Mo Mullet Lifetime Service Award for her work in public health over the years.
Well, I'm really quite humbled. I knew and worked with Mo Mullet, for whom this award is named. And to be following in the footsteps of Mo Mullet and Bob Harmon, and to be chosen by my colleagues in local public health is really very humbling and very honoring. Well, you know, I fell in love with public health when I got a job in a 3-county rural public health district. And I thought I was going there to be the manager. Well, little did I know I was going to be a student of public health for the next 34 years. It's easy to fall in love with. It affects the community. It touches us every single day, whether we're getting water out of a tap, whether we're going someplace and getting something to eat, or when something bad happens, it's public health who gives us good information and tells us what we can do about it. So it just seems to be just an easy thing to do, but hard work. I think NPHIC is a terrific resource for all of us. I think sometimes we don't realize that, but as soon as we have something bad happening, we've got to turn to the best. And NPHIC is amongst the best to get helpful resources to get us through those tough times.
You can just sense her passion for the field of public health, and certainly is a very, very deserving recipient. Well, of course, there was a lot of activity in the exhibit area today, lots of valuable networking going on, and of course, plenty of excellent sessions here at the conference. That is it from Dallas. I hope to see you in August at the National Conference for Health, Communications, Marketing, and Media. And then don't forget to sign up now for the NPHIC Annual Training Symposium. That's going to be in Chicago in September, and you are not going to want to miss that. Got some great stuff planned. So until then, I'm Kerry Shearer for the National Public Health Information Coalition here at the 2013 Annual Conference for NACCHO in Dallas.